Hello, welcome to the May event for the Ohio Student Nurses Association. Today we are joined by Dr. Theresa Puckett, who's going to talk to us about her experience nursing abroad and specifically in Romania. So Dr. Puckett, we are really excited to have you here. Thank you so much for taking time out of your day to talk to us.
Absolutely, thanks for having me. I'm going to go ahead and do a share screen so you guys can hopefully see my PowerPoint here. Okay, are you guys able to see it, Maris? Yeah, okay, good, great. Okay, so yes, hi everybody. Good afternoon. So today I'm going to present to you information about a short-term medical mission that I went to Romania. And I actually wrote a book about the experience too. And I called it An Inward and Outward Journey, and here's the book. So it's not a shameless plug for my book, just wanted to let you know why my slides are white with black. Basically, I was staying true to the aesthetic of the book, which was just kind of white with black writing. So there we go. So this is just a photo of myself. And basically here I'm in the state orphanage of Honaduera, which I'll be talking about the state orphanage. And then I'm just doing an assessment on a little person there. So I'm just going to move forward here. So I started thinking about medical missions back when I was in my undergraduate program a long time ago. And at that point, my kids were little. I didn't know if it was really the right time to leave them to go overseas. I knew that there were risks going to like certain countries, you know, as far as I could get sick, and I mean, just different things. So I'm like, you know, now's not the time. So when it was finally the time, I started to kind of look around for somewhere to go. But I want to point out that Florence Nightingale could really be considered the first nurse missionary. I'm not sure how much you guys know about Florence Nightingale, but she was truly ahead of her time. So she was living in the Victorian era, where women just basically were domestic. They just kind of got married and stayed home. And Florence came from a wealthy family, and she wasn't following this pattern of getting married and moving off and starting her own family. She wanted to go nurse soldiers in the Crimean War. And her family was resistant. They're like, what? Like, that's like beneath you. That's not something that you should be doing. At this point, there really wasn't like a professional role for nurses. And she did not get paid for going and doing this work. She, in fact, had to talk to the government and see if she could get permission to use her own money, her own way of getting there, everything, to do this by herself. So in a way, she was the first nurse missionary to go to a mission field of war, in a war zone, and nurse the soldiers there. So when I was looking for an opportunity for myself, it wasn't going to be quite that dramatic, but I was looking at more short-term options and seeing what was available there. Just so you guys know, you can register to help with disaster relief through the American Red Cross. And they have some different courses they'll require you to take. And then you're sort of on their registry for responding to disasters. So if you're interested in that, the thing about that, of course, is it's very spontaneous. We can't predict when a disaster is going to happen. So you can't really plan it out ahead of time. And for people with full-time jobs, it's sometimes hard to get the job on board to say, oh, you know, there was a hurricane down south. I'm gonna leave the job now for a while, right? So I just wanted to like let you know about the option, but I know that might not be feasible for a lot of people. So what I was finding was that there were a lot of short-term opportunities that were available more through churches, mission groups that were going that had multiple arms to them, not just a medical arm, but maybe like a Bible study, different things that they were doing, you know. So I found the International Children's Aid Foundation, ICAF, Christian organization based out of a church in New Jersey. And the pastor's wife is an adult nurse practitioner. And so they established an orphanage over in Romania that they run, the church supports. And they have, besides the medical arm of things, they have the Vacation Bible School for the kids in the area. They do a program called Bright Beginnings, and it's for children that are opting out of the orphanages. So in Romania, there's just not a lot of social services available, among other things that I'm going to talk about, but social services. And there just really isn't a lot for people that are, they've turned 18 and, they've been in the orphanages. They don't really have a foster care system as such. So that's why I'm sticking with orphanages. And it's kind of like, there's the door, you're 18, goodbye. So this organization does like job training with them, helps them to like find a place to live, like all these kinds of things. So if you're looking for a short-term opportunity, and by short-term, a week, 10 days, 2 weeks, which is probably more feasible to fit in with a full-time job, you might even look at maybe some religious organizations that have missions as part of the work that they do. There are, of course, long-term opportunities for nurses as well. Doctors Without Borders, even though it says doctors, they still have nurses that can serve. And then an organization that I've been super interested in for a long time, Mercy Ships. Now, Mercy Ships is interesting. They have ships that go up and down the coast of Africa, performing mainly cleft lip, cleft palate surgeries. And the reason
I love that.
What's that? Okay. I didn't know if there's a comment. The reason that that's so important, it's important, of course, for many different reasons, nutritional reasons, et cetera, but there's something in the culture in some of these African countries where if somebody is born with a visible birth defect, such as a cleft lip, which you'd be able to see when you look at them, that some people think that like that child is possessed by the devil. That child is then negatively stigmatized, and that affects not only the child, but their family. So fixing this is not just a matter of, helping this person's self-esteem, helping them to be able to get good nutrition. It's also a matter of just making sure they're okay within the larger social scope of things within their community. So that's kind of an interesting opportunity as well, but more so long-term. They really want you to dedicate 1 to 2 years. So this would be like if you maybe aren't in the midst of, raising a family and like things like that. So of course, whenever you're going to go abroad, you have to get your passport together. And then some countries will require you to fill out paperwork for a visa. So hopefully the organization that you're going with is, well established. They know all these procedures. For Romania, I did not need the visa. I just needed the passport. However, it was recommended by the organization I went with that we get travel insurance, because the insurance that you have here in the United States is not going to cover you abroad. So what I purchased was insurance that would help me for when I was in Romania, and it included an evacuation plan so that if there was a really significant health issue, I would actually be evacuated to Rome, Italy. So that was the plan. And that's important because the quality of the healthcare available there was and is not like the best. So if I had some major issue, I should probably go to a major city that has better opportunity for me to get well. The other aspect of the travel insurance, which was eye-opening, was that it included a plan for getting my body back to the United States should I die. But you have to think about those things. Like, what if you do expire overseas? Like, what kind of expense and who's going to arrange for your body to fly back to the United States? So that was sobering, but it's an important thing to think about. For some countries that you could go to on a medical mission, you might need additional vaccines. So it's important to check like the World Health Organization website to see for the country that you're going to, are there any additional vaccines that are recommended? I was lucky enough to be living in Cleveland at the time, where Case Western Reserve University has a Center for International Medicine, which includes a vaccine clinic, because even if you can read what extra vaccines you need, those extra vaccines might not actually be available just at your local doctor's office. Some of these are kind of out there. Luckily, I've served in the U.S. Army Reserve, and in basic training, they give you a ton of vaccines. And I was actually kind of okay with everything I needed, but it was good. It's good to identify, that that's something you should look into. Fundraising. So even though you're going to sort of like volunteer your own time on a medical mission, there's costs involved, and it's basically you are responsible for doing all that. Now, depending what organization you go with, they might have ideas, suggestions as to what to do. I hit up my family. What I did was I crafted a letter that just basically said, I'm going on this medical mission, could I ask for your support, donation, etc. And then what I did when I came back was I actually had a party for my donors, and had some appetizers and things and did a PowerPoint presentation about the trip. So, you know, it was just kind of like their little thank you for supporting me. So it was basically just some family members and, you know, but every little bit sort of helped. Learning the language. It might be helpful when you go to another country to learn at least some of the basic phrases, you know, where's the bathroom for when you're in the airport, you know, things like that. How are you, etc. So I went to a bookstore and I bought an entire full course of learning the Romanian language. It came with a book, it came with a CD and everything at the time. And I didn't have time to like do any of that. So I went there like not knowing a single word, but I would recommend that you would take the time to learn it, even though I did not do that. Now, one thing I didn't think about before I went there, and don't ask me like why I didn't think about this because I don't have a good answer for you, was what about, am I allowed to practice here? You know, here in the United States, every single state is different. You know, if I'm in Ohio, I have to have a license from the state of Ohio, right, to practice nursing. If I'm in New York, I have to have a license from the state of New York. So, you know, why didn't I think about, well, would another country allow me to just go in there and practice, right? And the organization that I went with, like they weren't saying anything. So I figured, well, it's kind of okay. So I didn't do anything special as far as trying to get licensed there. But what I would have liked to have done, and what I would suggest if you end up going, is figuring out, is it really legal for me to practice here? And what are maybe some laws, some standards of practice that I need to be aware of? So for example, when we were getting ready to leave Romania, after 10 days of taking care of people, we found out, oh, before you prescribe antibiotics, it's a law that you do a skin allergy test on the person to make sure they're not going to have an anaphylactic reaction to the antibiotic. Would have been good to know that going in before handing out tons and tons of antibiotics while we were there. So why the organization I went with didn't know that, I don't 100% know. But again, we are individually licensed people. This is part of our responsibility to practice within scope of practice, no matter where we are. So when I do this again, which I would like to do, I would look into these things a little bit further. So before I went, I wanted to learn more about the country itself and what was going on in the healthcare scene there. So what happened with Romania was that they were part of the USSR and they were communist, obviously, at that time. When the USSR broke up, these other countries kind of went off on their own, and Romania is about the size of Oregon. And it went off on its own, and a lot of people would think that that's a good thing. You know, I grew up in the 70s and 80s, Cold War time, and we were always taught, you know, communism is horrible. And I'm not trying to say that it wasn't, but at that time, I've spoken with people that lived in that area at that time, and they said, you know what, there were bad things about it for sure. But on the other hand, there was childcare available for every single kid. It's not like kids were left alone at home because there's no babysitter. Like there was a childcare center you could take your kid to, so you could go to work and stuff. There was healthcare available for everybody, etc. In the post-communist Romania, it went from being like kind of a socialized medicine model to having the private insurance companies, and not everybody could afford the insurance. So under communism, everybody had an opportunity to get some level of care. Under this new system, post-communist Romania, if you don't have the private insurance, you don't have anything. And then even with the private insurance, a lot of times it would be hard to locate a doctor, get in for care. I read that there were many situations where people would bring extra bribes with them to get health care, like at the hospital or even like a doctor's appointment, bring extra money, flowers, gifts, food, candy, etc., to try to get the care that they needed. So that was kind of interesting. Where we went was the city of Kriskor, which was in the Transylvanian mountains. If you remember, Dracula comes from the Transylvania mountains. So I think that was interesting. And then the mythical hen who lays the golden eggs also is from Romania. Now, I never saw the hen. I never found a golden egg, but I wanted to pass that along. So looking at the statistics, here of Romania versus US, and I didn't include citations on this, but this is from the time that I went. Again, I wanted to kind of get a handle on the whole scene of healthcare there. So looking at indicators such as infant mortality, definitely a lot higher than in the United States here. Looking at the per capita healthcare spending by the government in US currency, the government was only spending $190 per person on healthcare in Romania in, again, the post-communist era. Honaduera, whereas in the US at that time it's $4,499. So just again shows you just a lack of availability of healthcare there. And then when we look at how many doctors and nurses per 100,000, you can see that it's much lower. So trying to get in for care to these providers and even have nursing care is challenging. And then this is kind of telling too, the number of citizens per hospital. So every hospital in Romania needs to service 63,888 people. And they average anywhere between 200 to 400 beds. So that's a little rough. And then our average is 50,249, but we have 500, 600 bed hospitals as well. So it's just, again, if you're going somewhere on a mission, you might want to kind of look at some of those indicators so you know basically what you're walking into. I wanted to delve a little deeper than that high level and kind of see some other common healthcare system related issues that were going on. First of all, there's just in general a lack of medication in the country, especially antibiotics and psychiatric drugs. Now, luckily, we brought antibiotics with us. We did not bring psychiatric drugs. There's a lack of supply of syringes and needles given to administer medications and perform procedures. A lot of the medical equipment there is old, outdated, etc. You know, here in the United States, it's like almost every single hospital has the capability to do an MRI or to do a CT or do an X-ray, and it's just not the case there. You might, you know, if you're there and you need one of those services, you might have to travel for a few hours to get to a facility that has the equipment that is needed to take care of you. Their birth control is extremely expensive. And there's almost non-existent long-term care. Now, part of the reason for that is their culture is different. They live more as an extended family. So there's less need for long-term care in some ways because it's very normal for there to be the grandparents and the parents and, you know, the kids all living together under one roof. So why would you need the long-term care? But for people that maybe don't have that family connection, that, you know, there's like not a lot of places for them to go. Really almost non-existent home care. So if you can't get out to a provider, it's just very rare that someone's actually going to come to your house. Hospice is almost non-existent. PT, physical therapy, OT, occupational therapy, and social services, all very, very scarce. So going down another level here, I wanted to look at cultural considerations. If you go to another country, you don't want to do anything that's like offensive to anybody. So I looked at two different things. What are some things I need to know just with interacting with people, like in the general, like culture, what's acceptable? And then how do they view health? How do they view illness? How do they view wellness? So all these questions that kind of lend themselves to like this cultural assessment, right? Just so I could kind of get a handle on things before I landed on the ground. So first of all, the culture is sort of male dominated. So me being a female going there, it's just important for me to be aware of that, right? People do shake hands when introduced, so that's good to know. Direct eye contact is acceptable. In some cultures, it's not. It's offensive. So I wouldn't want to go there and, you know, look someone in the eye and they think that I'm being disrespectful. Nodding in agreement is acceptable. So that part is good to know. In some cultures, nodding could again be an offensive type of gesture. It's okay to do casual touching. So I was glad to know that because I'm one that will kind of put my hand on somebody's arm or, you know, try to give them a little hug or something. So it's good to know that that wouldn't be seen as offensive. Again, strong extended family. Alternative sexuality is widely accepted. So that would be good for me to know for any of the patients that come in that maybe are struggling with some issues with maybe their family not being accepting of them, something like that. Daily bathing is not the norm. So we have standards here in the United States, a lot of people taking a shower every single day, wearing different clothes every day, washing the clothes after you wear it one time. And, you know, that's just like not the case over there. So just to be aware, it's not good or bad, it's just different. And then lunch is actually their biggest meal of the day. And then looking at, you know, what's going on as far as their healthcare goes, because it's hard to seek care and because care is expensive and not everybody's got the insurance and things like that, they try different home treatments. So maybe with me working with patients in the clinic setting one-on-one, like I was going to do, maybe it would be good for me to ask, like, what did you try at home? What have you been doing? And ask about any home remedies that they may have been taking, including any like herbals or, you know, anything like that. The gender of the healthcare provider is not an issue there. So that was good to know. In some cultures, only the same gender can take care of the patient. So it's good to know that I wasn't going to have any issue with that. But this one was interesting. There's a high pain threshold and this pride in sort of not showing pain. And so that's difficult, because if a patient comes into the clinic and they are having an issue with pain, are they going to be honest with me? Are they going to minimize or diminish that? Am I going to be able to properly help treat the pain when maybe I'm not getting an maybe accurate pain score, right? There's a general dislike of taking medications, and especially like multiple medications, excessive medications, etc. So that's good going in, knowing going in as well. What can I suggest for this situation that doesn't involve medications, right? So looking at maybe some other complementary and alternative medicine type things that the person could try if they don't want medication. And then there had been a large outbreak of HIV/AIDS in Romania about maybe like 10 years before I went there or something, but that was still in the mindset of people. And so there's like this fear of blood transfusions because people don't want to contract HIV and AIDS. And then organ donation is just not very common there. And so that was just kind of a good thing to know. So my book, again, is called Inward and Outward Journey. So I'm going to talk about the outward journey, which is just basically telling you about what we did kind of on a day-to-day basis, some challenges, and then I'll kind of talk about what I learned from it, the more inward journey part of it. And then I'll give you some advice for if you're going to go somewhere. So the outward journey, basically, we as the medical staff of the mission team, we lived above the clinic. So there were rooms up there, and the lower left-hand corner here, this is my roommate, Renee. I literally took these pictures from the book, and they're in black and white because it's a lot cheaper to publish in black and white than in color. So that's why they're in black and white. But this is Renee and I, and we're organizing the medications in the pharmacy, just trying to come up with, you know, what's the best system? How do we organize this so that we can very quickly get the medications that we need? We brought with us $40,000 worth of medications. And what I didn't know at the time, but found out a couple of days after I was there, was it's illegal to bring medications into the country. So the pastor that was in charge of all this, he had to bribe the customs officials when we got there. He had to give them money to allow us to bring these medications into the country. And so that was sort of interesting. Like, we want to help, like we're here to help, and we brought all these medications. The medications that we were able to secure to go there were donated. And some of the medications were expired. So we were looking through and throwing away expired medications. They should have done that and not like hold them there, but whatever. We were doing that there. And then some of the medications were kind of newer to the market. They were obtained by drug reps, and they didn't have like the package inserts with them. So it would have been helpful. And this is just a hint for you if you're collecting medications or hitting up drug reps for medications to take with you on a mission trip, like make sure to leave the package insert with the meds, so that if it's a newer med that cannot be looked up in a drug book or online or, you know, whatever, like there's not a lot of information, you at least have like the package insert to look at. So anyway, then what we were doing was we had like Ziploc bags, and we were trying to organize the medications in 1 month supplies. Now, I had a lot of ethical issues with this because and those of you who have had pharmacology, you guys know this, there are a lot of medications that shouldn't be stopped abruptly. Now, antibiotics, you're giving like a course of antibiotics, that's one thing. But what about somebody walking around with hypertension? A lot of these folks had hypertension. I'm going to be showing you a table later on of the common diagnoses, but you know, do you start someone on an antihypertensive medication, give them a 1 month supply and say, go for it? I mean, you see what I'm saying? So I had these ethical ideas of, is it okay to start people on a medication that you know that they cannot obtain on their own and continue? And it was suggested to me by my translator, which I'll get into working with the translator in just a little bit, but it was suggested to me by my translator that people aren't going to take the medication as prescribed. Knowing that they only have a 1 month supply, they're going to cut each pill into like 2 or 4 pieces and take like a little portion of it every day. And you guys know that, you know, maybe they're going to take a dose that's not quite therapeutic, right? Now, one kind of fun aspect of living at the church-run orphanage was each of us was assigned a buddy. And that buddy was one of the children living in the orphanage. So my buddy was Ramona, and she was 18 years old. And at first I was a little disappointed that I didn't get like a younger kid as my buddy. I know that sounds selfish, but I really enjoyed being able to talk to Ramona. And she had all these dreams about wanting to go to college and just all this stuff. And, you know, I still sometimes wonder about her, but I think that was kind of a neat little extra thing that was thrown into the mission was, you know, that I had like this buddy, and there were suggestions of like if we wanted to bring gifts for them and stuff like that. So I had brought her some like a nice smelling body lotion and things like that. Now we had been given a heads up before we ever left for the trip that nurses are not respected in Romania. So it's interesting because I've encountered this same type of thought process when I've talked to people who've come from other countries and said, no, nurses aren't seen as professionals like they are in the United States. So we were not allowed to say at all that we were nurses. We were supposed to call ourselves medical specialist. So that was something kind of interesting. As far as numbers and what we were doing on a daily basis, we were opening the clinic every day that we were there, and there were about 100 patients that would come every single day. There were multiple providers, but there was 100 patients, and we were doing about 15-hour days. And we were a little bit jealous of the other teams that were on the mission trip that, you know, weren't working 15-hour days. And on the lower right-hand side of this, you can see like this, it's a little faded, but it's a grape arbor, and people are sitting under there because it's shady and they're just kind of waiting there. But this is sort of the beginning of the day, but word got out that we were there and people were waiting for us when we opened our doors, and there was just a continuous line of people. And I remember feeling so bad for this one lady because she was an elderly lady. She was all hunched over. She had a cane. And we were in a very hilly area. Remember, we were in the mountains of Transylvania. She walked on stone roads, like roads with all these little stones with her cane. She walked 3 hours to get to us so that we could provide care to her. So I look at this. Some of the people that were waiting for care, they waited for hours for us in this line, right? And I think about in the United States where people get very upset if they have to wait at their doctor's appointment. 20 minutes, 30 minutes, right? And it's annoying, and it's annoying to me too. But you didn't have to walk 3 hours in the mountains. You didn't have to wait 6 hours in the heat with the sun bearing down, right? So this is obviously like a much more desperate situation than what we face in the United States. The other thing I want to say about that is in the United States, we have the Medicaid program, the Medicare program. So we have some umbrella programs for individuals that don't have insurance, that have low income. You know, they are able to maybe get on Medicaid, you know, whatever, and get some care. There are no such umbrella programs there. You either can afford the private insurance or you cannot. There's no help if you cannot. So what were some specific challenges that we faced? Obviously, we had very limited medications that we brought. So people might come in with an issue and we might say, darn, I wish I had this med. We had what was donated to us. So we didn't have like this huge complement of a pharmacy. And some of that other stuff I already talked about, the expired meds new to the market. We had very limited equipment. So when I was there, I was seeing kids at first, being at that time pediatric nurse practitioner, but then they just started throwing adults at me too, which I felt a little uncomfortable with, taking care of the adults on that level. I, of course, had been a nurse to adults, but at the bedside, like at that level, not at the advanced practice level. So I felt a little uncomfortable, but I settled in and I gained more confidence in that way, which was kind of good. But a lot of the complaints that the parents had about the kids was they're not growing, you know, they're too thin, like that kind of thing. Well, I didn't have a scale. I didn't have a way to measure height. And even if I did, it wouldn't make sense to plot their height and weight on a growth chart from the CDC, because the growth chart is an example of a tool that was normed using American children. And in general, because the nutrition is more like poor and availability of food is less, in Romania, the kids are shorter and stuff like that. So if I even were to plot the kids on CDC growth charts, would that even make sense, right? It really wouldn't like tell me much. So no scale, no way to measure height, no thermometer. So, like trying to get a set of vital signs, seeing if somebody has a fever, they're not feeling well, they're sick. What do? You get a fever, right? So all these sort of protocols and algorithms that you have in your head, if the patient has these symptoms, do these things. If the patient has this condition, give this med. You can't do that because you don't have all of that. So you have to do what you can within your, scope of what you have available when you're in this type of limited setting. We didn't have any capability to like draw blood, get lab results, anything like that. And that was interesting because I had a lot of patients coming in saying, I have low calcium. Now, I don't know, I can't remember the last time that I asked a patient, what brings you here, right, to the hospital? I was concerned because my calcium was low. Like, it's just not something that's on our mind here, right? So we had no way of checking any kind of lab value. We didn't have any like oxygen equipment. We didn't have any emergency equipment. We had none of that, no crash cart nearby. So that was an ethical dilemma for me because I thought, what good are we doing here? What is the extent of the good that we are doing here? Are we doing enough good here? Are we doing any harm? Are we doing more good than harm? We're opening up a clinic, but we're so limited in what we're providing. Is it even worth doing? So I just had all these thoughts going on in my head like the whole time. We had no vaccinations to give out, which I wish we could have. I think that would have been good. The clinic didn't have any protocols, standards of care. How do you operate in this sort of limited setting? I think that the reason they didn't have protocols and standards of care is because every time they take a team there, there's different meds that were donated, maybe different people brought different equipment. So I don't know, maybe it's too hard to try to keep up with that and stick with a protocol or standard of care. But I would have liked some sort of guidance, policy, et cetera. We're used to that in the United States, right? I mean, that's a main thing that they tell you, like when you start a nursing job, like, go to the computer, here's where you find all your policies and procedures. And of course, we had no access to patient medical records. So you're seeing this person fresh off the street. There's no EHR where you're looking up like what meds they're taking, when their last exacerbation of this illness was. There's none of that. You just have them as historians, and you're hoping that they are good historians, that your translator is doing a good job telling you the deal, and that's all that you have to go on. No diagnostics, no way to prescribe any kind of follow-up care. You're seeing them one time while you're there, and that's it, right? And then no way to like give them any prescription for additional medications, get any additional medications to them, et cetera. It's a one contact time and that's it. And then I kind of touched on this one with those CDC growth charts. There's no applicability of tools. There's non-applicability of tools that are used, normed with using American children, right? It just is not going to apply in some other countries. And then, it would be, again, interesting. And an area I would have liked to have delved into more is what exactly are they doing, before they come here, and what capabilities do they have at home that I could kind of help with, especially for people with like PT, OT and stuff. Like, I'm not a PT or OT, right? So I don't know exactly like what exercises somebody should be doing for some certain thing. It would have been nice to have like something to offer people in that realm, some kind of basic guidance that I could give them for like PT, OT, because again, it's very scarce that they'd be able to get that in their country. And then the interesting thing is trying to figure out what medication patients are on. What's that med again? It's not in my American drug book. So, there are meds that are used around the country, or in different countries that are not FDA approved to be used here in the United States. And so when a patient would come in and say they're on this med, you're not recognizing the name. You have no idea, so you have to ask, well, what are you using that for? And then you have to try to piece it together. But, you just don't have the comfort of like looking up every single medication when they're on something that we don't have here. And then a large part of working in the clinic was managing patient expectations. A lot of people said, I came for American drugs. So there's a reputation that America has, the best healthcare system in the world, the best providers in the world, and the best medications in the world. Now, interestingly, if you go on the World Health Organization website and look up healthcare systems, the World Health Organization has rated healthcare systems, and they actually say that we don't have a system. What we have is, fragmented care. like just different silos of care, but nobody like really making sure the patient's taken care of. Not a lot of care coordination, you know, things like that, that we don't even have a system. So they don't even rate us. Okay. So it was kind of weird. But anyway, so they would come to the clinic and wait for hours, but not even, some of them like didn't even have a real problem, but they had a problem a month ago. And they would like some kind of medication for if they get that problem again later on. Well, you know that like we have to follow our nursing process, right? And even as an advanced practice nurse, you follow the nursing process. So, you know, you're really only going to give meds for a problem that they have right now, not for a problem that they had a month ago that might manifest itself again in the future. So that was kind of interesting. A lot of people just wanting to get their hands on some medications. And then it was a little humbling and scary that there were Romanian doctors who knew we were there that said, go see the mission team to get a second opinion. I think that that would be a good thing for you to do. Now, we were a team of mainly nurse practitioners. We did have a physician with us. He was a pediatrician from Australia. He traveled all the way from Australia, but he said, I'm not seeing adult patients. Like, I'm a pediatrician, I'm only seeing kids. So I thought to myself, oh my gosh, like I'm a nurse practitioner. Should I really be the second opinion for these doctors? So like, I just kind of was nervous about it, you know? So that's just goes back to, again, that, you know, I need to have a little more confidence in myself at that time. Right. Yeah, I already talked about the meds there. So besides running the main clinic, we also went out to more remote areas and held church clinics. So just kind of took over a church and set up a clinic. So, and the picture in the left, right by the building, you see people lining up already, hearing that we're coming to town and they want to see us. And then to the right-hand side, picture of us just choosing medications in our makeshift pharmacy. You can see the pews there in the church, and we just put the meds right on there, tried to organize them in a quick fashion because people were already waiting for us and we got to open the doors and we got to go. Real quick, put together triage. This girl in the shirt that said, I love New York, she was a nursing student. So we put her kind of at the front with some triage, and so she could figure out like which provider to send people to. So that was kind of interesting, going out to the church clinics. And then we also did some home visits. So here's me, I'm making a house call to a sick elderly man, and I'm doing his blood pressure and all that stuff. So they were really appreciative when we could go out to their home. So that was kind of what we did on a regular daily basis, but I want to talk about the challenges of working with a translator. So each of us were paired up with a translator that was with us for the entire time. So this is a picture of me seeing a pediatric patient with my translator, Dana. Now, Dana was wonderful, very wonderful, but she's not a medically trained translator. The team just basically found people that could speak English and Romanian, and then they had them translate. So you can understand right off the bat that there could be some issues using a translator that's not specifically trained for a medical situation. First of all, I really felt like using a translator altered the therapeutic relationship. You know, it's just kind of hard because I would talk to the translator and I would try to look at the patient and, like in this case, look at this boy and his mom while I'm talking. But then when they're talking, they're not like looking at me, they're talking to the translator. I just felt like there was something lost. Like I couldn't connect with them like I normally do with my patients and families. Working with this translator that didn't really have a medical background, I had to avoid medical terminology, slang terms, etc. with her. And then I really need to encourage Dana to translate the patient's exact words. What I found out was I would kind of put out there maybe this many words, Dana would say this many, the family would say this many, and I would get a yes or no answer in the end. So you just lose so much of like the patient's word choice, their rate, their tone of voice. Like there's so many paralinguistic cues that are lost when you're really depending on just the translator. And the more that her and I worked together, and this was the negative, the more that her and I worked together, the more that she was trying to like give her own medical advice, disagree with me on medical advice. And again, she's not like a medical person. And it was the more that she was trying to say, oh, they have the same thing that the guy this morning had. Well, no, I need to know the answers to the questions that I'm asking, because I'm trained to pick up these nuances in the responses. Dana is not trained that way. So that was a real challenge for me, to try to get her to like translate word for word. And then the other thing is just, being kind, offering the translator breaks, water, etc., because they're talking twice as much as we are, right? I'm talking to her, she's talking to the family's talking to her, she's talking back to me. I mean, that's like a lot of work for her. And then the other aspect that I didn't realize until I went on this trip was to offer emotional support to the translator. I don't know if you've had the experience of being a new nursing student, going into clinical, dealing with a patient that's really suffering, maybe traumatic situation, and feeling like, oh my gosh, I'm a little overwhelmed by the emotionality of this. When I first started nursing school years back, I would call my mom when I got home and say, oh my gosh, mom, it was just really overwhelming today. Because as a lay person, not in the medical field, just entering the medical field, you're not used to the emotionality of the pain and suffering that you encounter. And so I could tell at times with some of the stories that we were hearing from the patients, etc., that Dana just felt so bad for them, and she felt these overwhelming feelings. So being able to debrief the day with her at the end of the day, what went well, what could have gone better, is there anything she wants to talk about, how is she feeling about the day? Like, I thought that was like another very important key piece that I implemented for her and for her sake, because she's not used to hearing these stories, right? So we're getting to common complaints that we heard from the patients. My liver hurts. My kidney hurts. Like, when's the last time that you sat there and thought, I mean, stomach ache, yeah, but my liver specifically is hurting? Like, that's kind of weird, right? I'm sweating too much. I have excessive sweating problems. I mean, it's just like weird, right? The child is too thin. Nasal polyps. What is the deal over there with the nasal polyps and almost everybody having some sort of nasal polyp removed? Kind of like here, years back, it was like everybody kind of got their tonsils out. This was like, oh yeah, they had their nasal polyps removed. I'm like, what? So I don't know why that was so common or such a problem. The self-reported calcium deficiency. And then what I observed, people didn't come in as common complaint, but what I really noticed was so much poor dental health, a lot of rotting teeth. Looking in the mouth, doing assessment, teeth just rotting out. So adults, kids, everybody. So, lack of fluoride, no water that's enhanced with fluoride. I didn't put the dentist statistics, but hardly a dentist to be found. So I guess it all makes sense, but just really felt bad about the whole rotting teeth situation over there. So final statistic, oh, sorry guys, it has a mind of its own sometimes. Let me go back. So some final statistics here. Hypertension with the adult patients was a huge deal. It was pretty common that I would take a blood pressure for an adult patient, and it would be 200s over 100s. And, they just worked on their farm that morning and they came in because they heard we were here, and, they weren't complaining of symptoms of that. They had some other issue, but they're walking around with 200 over 100 blood pressure. It's like, oh my gosh. So there was a lot of that. Arthritis pain, 2/3 of the country is rural area and farmlands. So it makes sense. I think that they have more of a physical life than we do, more farm chores, things like that. Headache, respiratory issues, psychological was on there, GERD/ulcer, some ENT type issues, urinary, gallbladder, bowel, skin, the low calcium complaint, which was more prevalent than just 3 people, but I was going with like, what's the chief complaint that they're kind of, or the chief thing that I found. Diabetes and dizziness. Now the diabetes, this is another thing where we just didn't have the supplies that we needed. We had a glucometer, but don't have any insulin or anything. So it's like, okay, I can take your blood sugar and I can see that your blood sugar is high, but after that, there's really nothing I can do for you. Watch your diet, So that was a gap in our care. So some memorable patients, by the way, this is just a picture of me seeing this pediatric patient in the church clinic. Dana is translating, and I'm trying to listen to her. So one patient that I took care of really stuck with me. She was a 19-year-old that I saw at one of the church clinics, and he was deaf. Now, if somebody is deaf in our country, they can learn American Sign Language. There are schools for the deaf. They could be on Medicaid. Maybe there's even a surgery that can help them. But there aren't these safety nets there. There's not like go get hearing aids with the Medicaid program. So according to the mom, he had been deaf ever since he was a baby. Digging into the history a little further of the pregnancy, the delivery, the first days of neonatal life, all this stuff. And this is where being a good question asker is important. I found out that he had an infection as a baby and he got shots in the head. So what is that? That's antibiotics through a scalp IV, right? That's what that is. And antibiotics, especially IV antibiotics, can be oto and nephrotoxic. And what we do in the United States when we've given antibiotics to a baby, NICU step down, et cetera, PICU, is we do a hearing test afterwards to make sure they can still hear. So my thought process, and I could be wrong, he could have been born that way, but my thought process was, I wonder if he became deaf from the antibiotics that he got as a kid, right? So because they don't have all these safety nets there, this is what his life was like, okay? He never left his family farm. He didn't go to school. He didn't have friends, 19 years old, didn't have friends, never had a girlfriend, never went on a date, never went to prom, right? None of those things that we do here. So, his life is just going to be that family farm because of lack of resources. There was some gesturing that he and his mom did. It was not any kind of organized, because I asked this, it wasn't any kind of organized communication. It was gestures that they had established between themselves to communicate. So it would be very difficult for him to communicate with anybody else through those same gestures. I mean, we wouldn't know what the heck he's saying, right? Another patient was a patient that was 6 years old and looked like he was probably about age 2. Failure to thrive, and the mom said, I brought him here because I'm concerned he never grows up. He just never gets bigger. So normally here in the United States, failure to thrive diagnosis, it's kind of a rule out diagnosis. You bring him into the hospital, you kind of observe things, you do all kinds of tests. And when none of that pans out, it's basically failure to thrive. In a lot of cases. Now, sometimes you can find in the course of doing your diagnostic investigation, you can find the cause, but a lot of times it's more like a rule out diagnosis because like no other diagnosis applies. What could I do in my limited, I don't got a scale, there's going to be no follow-up, try to feed him more. I mean, what can I like possibly offer? So there was, and this is part of that inward journey. There was some thought on my end that like, I felt a little helpless sometimes in this mission trip, that I couldn't do enough, and I couldn't do what was needed, and in a way that was kind of frustrating. And then another situation that was kind of memorable was this child that was again 6 years old, and she hits herself, she bites herself. It was a situation where the mom had been in domestic violence situation with the dad, finally got away from that, but this child is obviously has some psychiatric issues, right? 6 years old, she doesn't talk, she's totally nonverbal, combative, etc. Again, that would have been assessed a lot earlier in the United States, and there would have been some diagnosis applied to that, maybe try some medications. It almost sounds like maybe a real low functioning autistic case. I worked for a facility for autistic children. So maybe something like that. But again, what can I offer in that situation for her, right? So that was hard. So I'm kind of watching the time here, don't worry. Moving on, one other thing that we did was we took a little trip over to the state orphanage of a nearby city named Honaduera. So remember, we were living in an orphanage, but it was run by the church group. The state orphanage was much different. So this picture that I show you, on this slide, it's got the cribs with the peeling paint. There's one toy. The way that these cribs were arranged, they were arranged around the walls of the room, and there was one toy. And the kids kept trying to steal the toy from the other cribs. There was one toy for all those kids. There were white walls everywhere. Why is that important? There was no stimulation. There was no visual stimulation on the walls. There was no toys for them to play with. The nannies that took care of these kids, there were 2 nannies for 40 kids. They did not pick the kids up. It was feeding time and I offered to help. And my inkling is when you feed a baby, you take them out of the crib, you hold them, you have the bottle, you give them cuddles, you sing to them, you talk to them. Oh no, I got yelled at. You do not pick up the babies. You put your arm over the crib or through the crib rails, they're kind of big there, and you feed them that way. You do not hold them. Because they had this lack of human contact, and because they were in the crib and they weren't given the tummy time and all these kind of like, you know, a mobile to reach for, you know, that kind of thing, a baby gym, you know, all that, huge developmental delays. You know, how do you learn to crawl? How do you learn to walk and everything when you're in a crib 24/7? So it was not unusual to find 1-year-olds that couldn't like pull themselves to a standing position and things like that. So I'm very delayed on those developmental milestones. One thing that really concerned me was the nanny with the tray of syringes who would come around at about 2, 3 in the afternoon and drug all the kids up. You hear about that kind of thing on Dateline and stuff like that. It was true, I saw it. So they're just, you know, kind of having a nap time there in the afternoon, and they're encouraging the kids with medication. I don't know what medication they were giving them, but they went to sleep after that. So I was very concerned about what the meds were that they were giving the kids. There was a room there with special needs children. That made me cry. I still think about it now, and it's just so depressing. So special needs kids always have a place in my heart, and I'm thinking particularly of kids with mental retardation, cerebral palsy, MRCP. And so there was a room there that they kept dark, 24/7 dark, no windows or anything, just kept dark. And they had cribs like around the walls again. There were kids as old as like 10 years old that had all kinds of physical maldeformities. They weren't tube fed. I mean, a kid in the United States like that, you know, they would have a G-tube, they would have a wheelchair, there would be therapies that are going on. These guys had all kinds of contractures of their muscles. I've never seen anything like it in my life. And they have absolutely zero quality of life. And again, thinking of all the therapy and services that a kid like that could get here, and then thinking they're just sitting in those cribs 24/7, I just really lost it. It was very traumatic for me to see that, and I feel so bad for them. Why were these kids in the orphanage? In the United States, you think about Child Protective Services being called in when there's suspicion of some sort of abuse going on, or when parents sort of abandon their kid, baby found on church steps, you know, that kind of thing. There was that there, but the majority of the kids there were given up due to poverty. The families could not afford the kids, and they thought that the kids would have a better life taken to the orphanage than at home with them. Sunday afternoons were visitation time, and the families could come and visit their child there. But I think that's really sad. That's another thing with the post-communism that I learned when I was there, was there's just not enough food to go around to everybody. Not enough food to go around. And then again, I kind of talked about no support after aging out of the system. So I did something I wasn't supposed to do when I was at the state orphanage, and I'll tell you about it now, because I don't think that you guys will get me in trouble. So I kind of connected with a boy there, Daniel, and he was 17. In a few months, he was going to be 18, and he was going to be kicked out of the orphanage, and he was very scared. He, again, had nowhere to go, no plan, nothing. I gave him my phone number. We weren't supposed to give any personal information out to anybody. You can understand that you shouldn't. I did not change my phone number. I had like switched carriers, all this stuff. I did not change my phone number because I was praying that he would call me. And if he were to call me, I would have done my very best to get him out of Romania. But he never called me. But again, I slipped in my phone number, and you're not supposed to do that. So adhere to the rules set forth by your mission director. So what are some things that I felt during this journey? I definitely, at first I was homesick. The first morning that I woke up in Romania, I couldn't believe I was like halfway, kind of almost halfway around the world. I'm like, what am I doing here? You know, I was like, oh my gosh. So that was kind of weird. I had fear of like maybe getting some weird illness, some weird bug, you know, or whatever. And then the ethical dilemmas that I kind of talked about. Didn't like how the orphans were treated. In fact, when we were flying out of Romania, when we were flying out, the plane took off, we're ascending. And I'm looking out the window. I had a window seat, and all I could think of was how I wanted to bring all those babies from the orphanage home with me. If I could have put them in my luggage, if I could have put them in my pocket, if I could have walked out the door. But Romania is closed to adoptions outside of their country. But boy, I would have tried to take those babies home. And then starting patients on medications that they can't finish, that they can have no follow-up on. I thought, should we really be doing that, right? And then when I got back home, after seeing such poverty and such lack of healthcare availability and access, the work here seemed meaningless. It seemed trivial, and it's not. And I'm over that now. But at first, it just seemed like I was more needed there. The needs there were so great that the needs here aren't as great. And then I also learned how to try to be comforting without using words. Again, I never cracked open my language course. So, trying to be comforting, what are some nonverbals that I can do, right? What are some ways I can convey caring, which is a very critical and fundamental concept to nursing is care. How do I convey that without words? And so that was kind of helpful. And I did have an increased confidence in my skills, because when you're out there in the field, missionary field like that, and you just don't have the supplies and you don't have clinic protocols and you don't whatever, you have to depend on what you know. And you have to still do the safest thing for the patient, follow the guidelines of care that you're aware of, follow the nursing process. And so I came home with a lot of increased confidence in my skills, which was kind of fun. So my advice to you, this is the whole medical team that was there that year, but my whole advice to you is learn some keywords and phrases. Only bad part is when people start talking back to you because they think you know the language, you don't know anything beyond your keywords and phrases, but it will still help you kind of muddle along a little bit. Assume nothing about the health literacy of the population that you're serving. In the United States, we have poor health literacy to some extent, but we have higher health literacy in general here, I think, than in Romania. So just kind of making no assumptions that people even have the basic idea that like high blood pressure is related to diet and exercise. Don't assume anything. Just kind of start at the beginning with any kind of teaching. And then another thing that kind of struck me is it's important to go alone. Because if I had gone with a friend, it would have been comforting to me to have my friend there. But would I have branched out and met the other people? Because I was just there by myself, I had to be social. I had to reach out, and get out of my comfort zone. If I was there with a friend, it might have just been me and the friend in our own little world, and that wouldn't have been as fun at all. So kind of like, don't drag a friend along, whoops. So I have not been monitoring the chat box. I was so into my little talk here. So I don't know if there's anything. Oh, I got a virtual hug. Thank you. I appreciate that. Yeah, some of this is very sad. And yeah, in Mexico, nurses are looked down as well. And yeah, so I don't think there's any real questions in here that I'm seeing. Anybody have any questions?
I do. I was holding on to mine. Okay, so I have a doctor who's here at Ped Surge in Children's, and we give him our expired medications, right? And he takes them across the country. How do they view that? Did you guys do anything like that?
We had expired meds, but we didn't use them. So I don't know if it's because we had enough other meds that we didn't feel like we could. I don't know. I guess from a safety standpoint, you could probably contact the manufacturer and say how much farther past expiration can we use it, just so it's not like completely wasted. Because usually, they're going to give the safest expiration date, but usually, like just like with food, like you don't necessarily throw your milk out like the day it expires, like maybe a couple days later, but not like the day, right? So how much longer can it be? So yeah, we just sort of threw out our expired meds. Good question. Anybody else have any questions?
Dr. Puckett, I don't have a question. I have more of a comment.
Yeah.
I kind of smirked a little bit when you shared that some of the patients were saying that their liver or kidneys hurt. In Egypt, a lot of people will like complain about what they're feeling, even if it like doesn't medically make sense. And that just reminded me of that, because a lot of times, like especially elderly population, they'll like hold their like flanks and they'll say my kidneys are hurting me. So it's like really interesting. Yeah.
It is. Yeah, just how people just even describe their pain, right? And where it is and what's going on with them. Much different and things like that. Vinay, how did I get the opportunity to go to Romania? Yeah, I kind of said that at the beginning. I looked for opportunities online. I really wanted to go on a short-term mission trip. I found this short-term mission trip that was available through a church. They'd been going for several years. I figured they probably got the formula down, that it would be pretty safe to go with them. They seemed to know what was up. So yeah, I just basically did internet search and then just connected with the group and went from there. And I will say, because it was through a church, there were some other things that I didn't talk about, like with the more like religious aspects of it. Like I did go to church there, with everybody else there. There were just some other aspects to it besides just giving the medical care, because it was with a religious group. So yeah, good question. Anybody else have any questions? I know we're running out of time, but anybody have anything else? Mara shook her head no, so we're not running out of time.
You can have as much time as you want, Dr. Puckett.
All right, sounds good. Yeah, so Chelsea, I will get you a copy of my book. If you'd like a copy of my book, I will get you one. Because I'm not here to pitch the book. Like, if you'd like it, I'd be very happy to give it to you. And then when you came back from the trip, was it difficult to, hold on a second. Was it difficult to get back to the normalcy? It really was, because again, I kind of, and I know this is going to sound bad, but I kind of felt like, well, aren't Americans spoiled? Aren't they spoiled with all the safety nets? Aren't they spoiled with all this stuff? And it's great that we have that, but I thought, look at all the suffering of other places. And is it equitable? You really start to think about, maybe this is my own moral dilemma, but should I have the things that I have? Is it fair that I have the things that I have when there's other people that have so few things? And it really gets you to kind of think of your life differently. Like, do I really need to be acquiring as much? Do I really need to be so materialistic? Do I have to stop for a coffee at Starbucks every day, or should I donate that to someone? Right? Yeah. Maybe those are like my own.
It almost sounds like survivor's guilt. Do you know what I mean? Like,
yeah, absolutely. But there's definitely things we can do. One thing I didn't talk about was we had a lot of donated eyeglasses. Now, mind you, we couldn't really do like, we had an eye chart, but, we didn't have an eye doctor there with, dilating the eyes and doing all that whole thing. But, that's something that we could all do, right? Like, if you have old glasses and everything, like, don't throw them away. Like, could we, because you like outgrew the prescription, like donate them somewhere. Like, so there are little things that we can do to help other people and things like that. 10 days, it was 10 days, but it was a pretty impactful 10 days. And then, yeah, you guys can always email me about the book, but again, I'm not here to like sell it at all. Did the nannies, hold on. I'm not doing a good job with my scroll bar. What's the question about the nannies? Oh, Chelsea felt that way coming back from that. Did the nannies in the state orphanages just choose not to hold the kids because they were short staffed, like a resource? I'm sure that they did care, because I saw good examples of parents being physical with their children as far as hugs and affectionate from the parents and kids that were coming to the clinic. I think it's because there were 2 of them for 40. And the easiest thing to do is like, I stand between 2 cribs and I put the bottles like this and I feed 2 kids at once and then I move on. Even diaper changes, they had certain times of a day that they changed a diaper. A kid could sit there wet for hours if it was in between these times. I witnessed that myself. So if, they were very systematic, because they had so much work to do. Like, they were very systematic about how they approached the kids, very like robotic, if you would. And so I think it was more just like the short staffing and things like that. And yeah, you start to feel guilty. I'm going to adopt a child outside the country when I'm done because of all the documentaries I've seen about abuse and hopelessness in other countries, right? And honestly, like when I came back and people started to complain, I had to wait 20 minutes for my doctor's appointment, 30 minutes for my doctor's appointment. I was like, are you kidding me? Are you really kidding me? Thanks, Lauren.
Dr. Puckett, do you think that that's because the way that our system is set up? For instance, if you come to our doctor's office 10 to 15 minutes late, they cancel your appointment. So you're saying if you're going to cancel my appointment in 15 minutes, don't make me wait for 20, 30 minutes to get in to see you. So I think maybe that's a system thing and we've installed that. Whereas I don't think if somebody showed up to the clinic that you were running, you're going like, oh, I'm not going to see you, So right. Because it's very forgiving, people are very forgiving towards you.
Yeah. And I also think it's our culture that, like, we want everything right now. We're very impatient people. We drive up to a window and get food. You know what I'm saying? Like, I can't cook something at home. I want to go get it right now from down the street. We're a very impatient people in this country. And so I think that kind of plays into it too. But over there, like I said, they were so grateful. They were so thankful. I felt like the work we were doing was very meaningful. Like I thought, oh my gosh, like I really felt like we did do a whole lot of impact, not just with the medical team, but the other aspects of the mission as well that I wasn't directly involved with because I was in the clinic. But overall, I think the whole thing was like just extraordinary. And I would love to go again. And maybe not even there. I mean, somewhere, right? I'd love to do mercy ships for a couple of years. Like now that my kids are grown and stuff, I think that would be cool.
Do you need like some sort of experience to get like a better chance of going into or like getting picked for something like this, or like would knowing the language of the place you're going also impact that?
Well, like for the one that I did, like short-term ones with, especially with churches and stuff, if you can show an interest and just pay for it, you're good to go. There's no like whatever. Now, mercy ships, for example, you have to apply for, you got to get accepted, that kind of thing. For increasing chances there, I myself have looked into that mercy ships a little bit, and I think like there's different universities where you can get like a certificate in like tropical medical diseases. Like, I mean, there's like, mission nursing, like there's different things like that might be helpful. And, I don't know if they would exactly 100% like improve your chances of being selected, but definitely like make you feel more prepared. But if there was one of those organizations that you were interested in, you could always like contact them and see like what would make it my chances of going better, whatever. But a lot of these, they really are like looking for volunteers. Like if you have the time to do it and like you can financially swing it, they will take you. That's for sure. And then mercy ships specifically, by the way, because they're surgical, they do like the cleft lip, cleft palate repair. They're looking for people that have like OR experience, PACU experience, that kind of thing. So by the way, there's so many roles for nurses, you guys, beyond like just being at a hospital here in the United States, like this thing I'm talking about with mercy ships, but like even, I know the cruise industry is a little dampened right now, but when I went on a cruise a few years ago, I took a little field trip to the basement to go to the clinic, and I was talking to the nurses there, and they were from all over the world. Like there was like 4 of them in there, and they were all from a different place, different country. And for that, it was ICU experience. So they said, yeah, you have to have ICU experience, which makes sense because, there's going to be like emergent situations that happen on the boat. You're not going to be able to like vacate people off the boat quickly. So you got to have like ER experience, ICU experience, like all that stuff. So yeah, wouldn't it be kind of cool like to be like a cruise ship nurse?
My dad was the station doctor at McMurdo Station in Antarctica, and he got, there's obviously exactly what you're saying, like there's a group of people there who are going to experience medical emergencies, and so there were nurses there as well who their whole job was just to be there in case of emergency in Antarctica, and they had things like appendicitis all the way up to like massive traumas from equipment accidents. So there's like really, really cool opportunities everywhere.
There is, and I've seen the job ad for Antarctica, and they were talking about having a background in ER, ICU.
Oh yeah, he loved it, and he said like he just wouldn't stop talking about it, and how if you were into emergency medicine or sort of like the unpredictable, like you should definitely go down there. He was an OB-GYN, so I don't really know why he wound up there, but he had a blast and said anybody who wants that kind of experience, and especially like you were saying about non-traditional medicine and not having access to everything you need, it's a pretty cool opportunity.
I think it is. And I think like doing a mission like this, or even maybe being in Antarctica, I think it really makes you use your critical thinking skills. Because again, like, you don't have everything you need, or you can't do things the same way. So what can you do? And just really pushes you to like another level, which again, I think increases your confidence ultimately, because you're like, well, if I can take care of patients in this setting, then certainly when I go back to the United States and I have everything that I need at my disposal, working at Riverside, certainly like I can be a good nurse there if I can be a good nurse here. So yeah, really interesting stuff. And then I'll just say like, just a little plug for Cleveland Clinic, just because, Cleveland Clinic does have locations all around the world. And when I was working there full time, I knew of nurses that went to Dubai, and they worked at Cleveland Clinic Dubai. So they took, contracts there, and like, that's kind of interesting, I never talked to anybody who came back, but you know, it was more longer term. So, you know, they were like people I worked with, maybe not my like friend as such, where I'm in constant contact, but you know, a nurse would be like, well, I'm not going to see you for a while. And I'm like, oh, where are you going? I'm going to Dubai. And I'm like, oh my gosh. So it's kind of neat, you know, that healthcare system's not that far from Columbus. And so, you know, looking at like Cleveland Clinic, when you go to their website and look for jobs, they'll say, you know, there are different locations and things. So, you know, why not? Like if you can do it, why not go travel far away, right? It's kind of fun.
I have a question.
Yeah.
So I don't know if you know the answer to this or not, but I thought Chamberlain offered like abroad, like a semester, but I don't know if they are doing it because of COVID now, or because I haven't heard anything about it.
I think it's on hold because of COVID, but I'm not like in charge of that. But it was like for the community rotation, like for the hours for community. So like I know a student that went on the I think she went to India or something.
Mm-hmm.
So yeah, there's different options for sure, but unfortunately because of COVID, it's not running right now. But it is kind of neat that you know, once all that resolves, there'll be hopefully that option again.
Yeah, pay attention to your course schedule, because you can go during community. So in place of taking community nursing through like the traditional brick and mortar, you can substitute it with the global health experience, which is usually 2 weeks abroad. And then you have 6 weeks of like the online classroom where you're writing papers about your experience and things like that. Unfortunately, my session was the session that they canceled for COVID. So I am hopeful that they will get you guys back in that soon, because I also have a friend who did the India trip, and she just gushed about how incredible it was, and really what a wonderful experience. So definitely take advantage of that if you can.
Yeah, definitely.
And they are trying to work on getting it back, I think, for us this time around. But we'll see how everything goes. And I'm hoping that all the people like Maris and those who didn't get to go on their last one, maybe they can make an exception.
That would be great.
Yeah, I'll petition them. Let me come too.
Exactly. All right. Well, that might be it. And
yeah.
Oh, Jeff wants to put together your own mission trip.
I love it, Jeff. Let's do it.
I tell you where there's a big need that's not that far from Columbus, and you wouldn't need a passport or visa. Appalachia.
Yes, absolutely.
A huge need in Appalachia. And I know there are church groups that mission to Appalachia. So, you know, that's another thing too. Like if you're like, I'd love to do a mission trip, but do I really want to go abroad, especially with, you know, everything that's happened with COVID and all that. It's like, there's areas within the United States that are, you know, of desperate need. And Appalachia is one that, that comes to mind right away. So.
Well, thank you so much, Dr. Puckett. We really appreciate your time and sharing this with us. If you wouldn't mind sending me the link for your book, or however we can get it, I will add it to the description of this recording as well, so that anybody who wants it can find it. And we just really appreciate you sharing your expertise and experience with us.
Absolutely. Thanks for having me. And happy travels to everybody if you go somewhere.